Well, hello, everybody. Kristen, are you still cleaning up your spilled glass of water there? Right as we went live,
Yeah.
something. But hey,
this
will just give us a couple minutes to let people jump on. It's been a little while. Happy Saturday. It's been a little while since we've done a happy hour with Kristen and Tammy. So grab your glass of wine or your beer or your cup of coffee, whatever it is your fancy, and join us because we have a lot of information to go over with you guys. In fact, you should probably grab a notepad. Those of you that are really interested in this are going to want to take notes. It has taken Kristen and I a day and a half to unpack everything that happened with the Supreme Court's oral arguments yesterday because there was so much wrong. And we've been banging our heads against the wall and pulling our hair out and just really dissecting this, taking notes, because there was a lot. If this case was actually to be heard on the merits, there was a lot on the merits that was totally left out. And that was very frustrating for us because we thought, how can these Supreme Court justices rule on the merits when they're not even given the merits? The majority of the merits, the most important talking points, the technical issues were not even provided to them, which is very frustrating to us as subject matter experts and court-approved subject matter experts on all of these things. So we wanted to go through and give you the information and really break down everything that was said in the oral arguments by both sides yesterday. So I'm going to let Kristen start out by explaining, first of all, what is an emergency temporary standard? Because this particular case was basically a case that was discussed from the OSHA and the CMS perspective. There were 4 cases brought before the Supreme Court. 2 had to do with OSHA's ETS and 2 had to do with CMS, which is the Centers for Medicare and Medicaid Services that regulates payments to healthcare facilities who receive those payments. So what the court did was they combined them all into one, and they heard arguments regarding OSHA, they heard arguments regarding CMS, and this was mainly this was the National Federation of Independent Businesses versus the Department of Labor. Attorney Scott Keller argued initially, and it was also on behalf of 27 states and 27 attorneys generals who brought this, which really, to be honest with you, is the most frustrating thing to me, because out of 27 attorneys general, you couldn't find the subject matter experts to really argue for you. But I don't know, the court only gave 1 hour. They only allotted 1 hour for arguments. So I'm thinking, and I know that went over, but I'm thinking maybe this just wasn't the time, because this was only oral arguments and they have thousands of pages of written briefs that they're going to be pouring through. And we know that some of our testimony was read. We heard our testimonies read and included in those, not the oral arguments, but the written documentation that Attorney Scott Keller actually did cover a little bit of that. So first things first, what is an emergency temporary standard, Kristen? What is this all about?
Sure. Well, going to give a quick little overview to get people to understand what OSHA is and how it was founded. So workplace safety has been around for a very long time, but it wasn't until around the late 1960s they decided that there needed to be some sort of agency to ensure that employees had the right to a safe and healthful work environment. So Congress passed the OSHA Act, or OSH Act, however you want to say it, of 1970, which basically allowed the agency to be started and for them to be implementing standards. Now, OSHA, people get confused because they say OSHA, like, rules are not a law. Correct. However, the standards are enforceable by law. What I mean is you can go to jail. That's why I always tell people in my profession, I'm not going to jail for anybody, which is why I would never put people in those face things for an aerosolized virus. But so they are enforceable by law. So an OSHA regular standard, like the respiratory protection standard, that takes an average of 8 to 10 years to be promulgated. And it has a long process of public review, professional review, Office of Budget Management review. It is a long process. And it's like every time it goes to an agency, it's got to come back to the drawing board. Excuse me. So the act, what it did is it also gave OSHA the power when there is an emergency. That's why it's called an emergency temporary standard. But an ETS can only be put together when 2 things are met. 1, well, actually 3. There's no standard that already addresses it. There's not. There's no standard that addresses this type of infectious disease because OSHA has no infectious disease standards. Closest thing would be the bloodborne pathogen standard. So they have to show under an ETS. 1, it has to come from Congress, not from the executive branch. that there is grave danger. And in our profession, although there's no literal definition of grave danger in OSHA, historically, grave danger, like I can shut down an operation. I can shut down a business and I can say, this is grave and imminent danger. We have to stop this process. I've had to do that. I had to do that when I identified a chlorine gas leak one time.
You're saying when you're saying I can shut that down, you mean those of us in our career fields who are the inspectors. We come
Correct.
in as OSHA inspectors,
yes,
right?
or if
Correct.
I've been embedded, I've had to shut down processes inside of hospitals. Why? Because there's asbestos falling out of the ceiling during a water leak. I can shut processes down if I'm hired on to be an industrial hygienist. But people that work for OSHA can do it for any business. But basically grave danger. So grave danger is more imminent danger. That is going to have a likelihood of serious injury, illness, and more likelihood of death. Okay. So I don't believe at all that this constitutes grave danger. Also, you have to have a necessity of the standard. What that means is if we did not have this ETS and the provisions within, then it would be an absolute hazard to everyone. It's not. But we have seen this with ETSs that have been attempted or altering current standards like benzene or dealing with strontium chromates and cadmium. Sometimes we find out that something that we've already had an occupational exposure limit for, we find from other countries or tracking trends of cancer, oh my goodness, we need to lower the exposure limit because science is saying it's more hazardous than we thought. That's what this is originally designed for. So the ETS, when we are talking about this, I was very shocked at the very beginning of this, that I believe it was Keller, the attorney, was basically saying that they conceded that this is grave danger. And I went, what in the world? This is not grave danger.
The numbers do not support that.
It is a hazard. Yeah. Just like you having a house near a utility line can be a hazard. It's EMF. So a hazard doesn't necessarily mean it's imminent danger. And I know people have lost their lives, but people lose their lives to a whole myriad of other issues. Yeah. So I personally do think there should be some sort of infectious disease standard, but only in healthcare, not for the general public. Right. So basically, from the get-go, we told you OSHA doesn't have the statutory authority to do this for a whole list of reasons. It's outlined in the peer-reviewed white paper that we put out. But what we both did is I listened to this live. My home security system probably has a lot of adult words on it because I was screaming as I was listening to this. So what I wanted to do, as long as there's no hiccups, why I'm pulling this up, we're going to play the audio. So this is the thing. We are very honest individuals. We don't let any sort of political bias. I'm more of an independent. I'm a voluntarist. I'm on neither side of the aisle. I don't let my personal political beliefs change the rules of our profession and the science that has constantly existed for decades and is also re-verified that it's correct. But basically, I'm going to play the clips because I'm not going to say, well, did you hear this? Because people will want to go back and attempt to debunk it or be confused. I want you to hear it come straight from the mouths of the individuals that said it. So I'm going to play the audio from my phone. I tried to do a screen share, but I'm worried about my internet right now. I want to go over the most shocking things that I heard. And it actually happened like very, very early on. And it was the fact that Tammy and I have been screaming from the rooftops that an ETS, and I failed to say this in the ETS when I was talking about this earlier, but the most important aspect of this, and I think you'll agree with me, is you can only have an ETS and the necessity aspect. For example, they're saying that you need the jabs. We're going to say jabs for censorship reasons. You need a jab, and if you don't have the jab, you have to wear the thing, and you have to have weekly testing.
Yes.
You can only do that if no other control methods exist. The hierarchy of controls has been around since the 1950s, and you and I both know that the best control method is an engineering control, yet we had to listen to Justice Kagan say over and over that these jabs are the best control method. So I want to start out right here where they actually admit, I have to give Keller this piece of credit because Keller said that this ETS can only be done when all other measures were explored and didn't work. So I'm going to hopefully I'm going to look at the comments here. Hopefully everyone can hear.
I wish that he had gotten into what those other measures are. That's where you and I were like, yes,
engineering controls.
He's going there. And then he didn't go there and he didn't deliver the merits. So that's what we need to give you so you understand. So we have a whole outline. We basically are going to work through the entire thing, point by point, what was so wrong, and then what did they say that was right. So you have educated talking points. And again, like Kristen said, we are very transparent. If you don't know by now that we are just the most honest, genuine, transparent gals there are, what you see is what you get. We do not hide anything. And so we don't want you thinking this is our opinion. Well, it is our expert opinion, and we are subject matter experts in this area, but we're also going to let you hear for yourself and then really go into all of it and explain all of it. So I want to say, before you play that, Kristen, I want to also say, in this particular ETS, it is stated in the preamble to this ETS, for the first time in its 50-year history, OSHA faces a new hazard so grave that it has killed nearly 600,000 people in the US in barely over a year and infected millions more. Not true, not true, not true, not true. And we're going to get into that in just a minute. Okay, so I just wanted you to understand, they start right out by lying, bold-faced lying. And Fauci's admitted that these numbers are skewed and they're intentionally inflated. We're going to talk about that. And they have faced these types of pandemics and these types of numbers. And we're going to get into that too. But I just wanted you to understand, right in the preamble of this emergency temporary standard, they start right out by bold-faced lying. So, okay, go ahead, Kristen, and play what you have in the beginning here.
The first attorney, Keller, representing why he believes this should be stayed at their level.
Factors do you think we should use?
Justice Thomas, I think the first factor that you would have to look at is an indispensable or essential measure. That necessarily would require looking at what are the alternatives available. You'd have to also look at necessary to what end, and it's to abate a grave danger, and it's for an emergency. It's in a temporary setting. So the factors you'd want to consider are, what are the risks? And not only what are the risks for any isolated situation, but compared to an everyday risk. Here,
that's an important point. So that is what we've been saying. That's what, out of everything, there's so many angles that this is illegal. But to me, the strongest angle, even if they had the statutory authority, you didn't attempt to use other control methods. The only time, I would be right here, I'd be testifying in favor of the ETS if this thing was so hazardous, it was wiping out millions of people, that the IFR rate was just astronomical. But no, for most people, this is a greater than 99% recovery rate. So the problem is we would have to show that we can't eliminate or substitute the hazard. Okay, we can't. It's an illness. But the engineering controls, where did OSHA say, you know, we actually tried engineering controls like dilution and destruction technologies as source control to eliminate the hazard in buildings and draw it out of the breathing zone by increasing air exchanges per hour? Have you heard that? I haven't. So if you didn't try other available control methods, you can't jump to this type of control. But Tammy, explain to people why these jabs are not a control method. Therefore, they have no jurisdiction with OSHA.
Absolutely. And that's very important, because I want to read something to you that Justice Kagan said, the whole time. First of all, let me just start, before I get into that, about the hierarchy of controls and why vaccines are not a control. Let me just start out by saying that it was very clear who is an activist judge and who is a judge trying to apply the law, you know, per congressional legal standing, the U.S. Constitution. It was very clear who was highly emotional and trying to interject their opinions and their emotions versus who was actually trying to apply the law to the situation. So they were really supposed to, they're not supposed to be hearing the merits of the details of this case. What they were supposed to be deciding in this case was, does the regulatory agencies like OSHA have the statutory authority to do what they are trying to do? And does the executive branch, the main thing they're trying to decide here is, does the executive branch, which is the Biden administration, have the authority to enact sweeping mandates by weaponizing regulatory agencies. And we're going to get into what some of the justices said about that in just a minute. But Justice Elena Kagan actually stated this is the policy that is most geared to stopping all of this. There's nothing else that will perform that function better than incentivizing people to vaccinate themselves. Really, Justice Kagan? So she said, why isn't this necessary? Because there's nothing else. Well, that's false. We're going to get into that in a minute. She stated that this country has never faced anything like this. That's false. We're going to get into that along with control measures. And we know that the best way to prevent this spread is to get vaxxed. Do we know? Do we know that that's the best way? Since those that are getting vaccinated are spreading and they're still getting sick themselves. So what she's doing there, what she was doing is she was interjecting her own biased opinion and conjecture and all of that. And that was so outside of her job description as a Supreme Court justice. I was absolutely shocked that that's how she was acting and the kinds of things that she was saying. Her job is to take the law, written black and white law, and apply it to this situation, period, not her opinion. So let's break down the why this was not true. When Justice Elena Kagan stated that this is the policy most geared to stopping all of this, where is she getting that?
Well, let's pedal back just for a second because I have the same timestamp on there. And just the other things I had written down, but I don't feel is worth playing on the audio, is that Justice Thomas just said, you know, why do you think the government didn't act on this in the last 2 years when Congress had the power to do something?
Exactly. That's one of the talking points I have in here, that Congress has not taken this up in the last 2 years. And why is that? Because every congressman and woman knows that would be political career suicide to do so.
And then right after that, Attorney Keller had come forward and basically said, if this is such an issue, why didn't OSHA do an emergency nationwide business shutdown? Well, that's because they don't have the authority. It's too far and overreaching is what he was basically saying. And then we have, well, let's just listen to, wow, Justice Kagan. I have to just say real quick that a lot of people don't sit here and listen to oral arguments all the time. Myself included, I really don't all the time. She showed who she is, and everyone should be disgusted that this person sits on the Supreme Court. So listen to this.
So did Sotomayor. Same thing.
Oh, yeah. Oh, but let's not forget, I think it's Breyer who just came across as a condescending goofball, basically. So listen to this.
Yep.
Context.
I guess, Mr. Keller, I don't understand the point. Whatever necessary means, whether it's a necessary and proper or whether it's something more than that, why isn't this necessary to abate a grave risk? This is a pandemic in which nearly 1 million people have died. It is by far the greatest.
I have to stop right there. We do not know how many people have died from the illness.
Right.
We know that now we are big about staying in our lane. So let's throw this out there. The information we're providing to you is because we're attached to the frontline doctors and nurses, and we get all the information. Plus we have people, especially in the state of Michigan, working at Beaumont that are just blowing the whistle. People have died from the illness. Oh, I'm sure of it. But we also have people who died because they were not giving treatment. And I cannot remember where I heard this or I'd cite it. I think I was listening to a podcast or maybe a person. They use the comparison of, well, you go in and say you get diagnosed with stage 1 breast cancer. You don't send someone home and go, come back when it's stage 4. You give them something prophylactically and you start treatment. And the first thing you do when you get diagnosed with cancer is they tell you, eat as clean as possible. So the death thing is very, very, very questionable for the simple fact of, did they die from the illness or did they die from lack of treatment from the illness? Or did they die in a car crash and then they tested them after the fact and got included in those numbers? But it goes on. It's quite a gem.
Danger that this country has faced in the last century. More and more people are dying every day. More and more people are getting sick every day. I don't mean to be dramatic here. I'm just sort of stating facts. And this is the policy that is most geared to stopping all this. There's nothing else that will perform that function better than incentivizing people strongly to vaccinate themselves.
Okay.
There you
I'm
go.
not trying to laugh, but I'm also cross-credentialed in public health, and my husband is a public health professional. This is not the greatest public health issue we've ever had in the latest century. It's not.
No. In
Um,
fact, I have some numbers on that if you want me to go over that a minute.
Go right ahead. I've got numbers too, but I'll let you.
Okay, so let's just set the record straight on some of the bold-faced lies that they claimed. First of all, this is not the greatest health hazard, the biggest issue that OSHA has ever dealt with in their 50 years, the biggest hazard they've dealt with. It's
she
so
said
grave.
the country.
In the country, yeah. Well, yeah, exactly. In 2009, we had an H1N1 outbreak that claimed nearly 1 million lives. That's according to the CDC. And yet, what was Obama doing during that time? Because he was president. Nobody was saying a word about it. He's out golfing, nothing but a nothing.
Weddings and schools.
Totally nothing
also,
burger. Just a new virus here. What's the big deal?
But I got to interject real quick, because another point to that, Tammy, would be, you just said, up to around 1 million people died. But this isn't a time where, like, we weren't in an election. They weren't, excuse my language, but pushing fear porn. This thing is very real. I'm not a COVID denier, but the problem is we are testing because of this psychosis that we're in. Everyone, you just fart and you're like, oh my gosh, it's COVID. I mean, I had a sinus infection and I didn't get tested because I get a sinus infection around New Year's Eve every year for the past literal 12 years. I can prove it. But my point is, that was during a time where people were not like pushing to get tested. We weren't yelling at people. It was probably a higher number. And they didn't go to think, oh, was this an H1N1 death? No, they didn't do that. So I feel like those numbers would have actually been higher.
Oh yeah, and they now claim, we now know that it claimed nearly 1 million lives. There was nearly 1 million deaths from the H1N1 outbreak. Nobody thought anything of it. OSHA wasn't saying a dang word. They were not concerned with getting involved because they are not in the business of public health. They are not public health professionals. They are involved in workplace safety and health, and that's it. But they're not public health professionals. They don't create public health policy. So nobody said it was a nothing burger, really. It was just a new virus. It swept through. And now it is endemic to our society, and there are infections and there are deaths still every year from H1N1. Do you ever hear about that? No, because that is exactly what happens with viruses. That is the nature of all viruses. And guys, we deal with millions of viruses in our world. And just so I just want to address the fear porn that Kristen was talking about. Do not be afraid of viruses, of bacteria, of pathogens, because that is how the world works. We carry viruses and viral fragments. We carry bacteria and pathogens in our bodies. We are designed to come into contact with each other's stuff all the time. That's
like
how you keep the
terrain theory.
That's exactly right. That is exactly how our bodies were designed to work, because when you come into contact with, other people's pathogens, your immune system is really, really boosted and it keeps it strong. The worst thing that you can do during a viral outbreak or, whatever, cold and flu season, honestly, is to isolate, because then your immune system takes a vacation and you come into contact with everything. I was always one of those moms who, even during cold and flu season, I let my kids go to the McDonald's playlands. I did not care if they got the sniffles, because honestly, what is healthy about that is it keeps their immune system constantly engaged and coming into contact with pathogens that keeps it working strong. That's how it's supposed to work. So don't be afraid of that. So what were some others?
But also real quick, and I just want to say this before any like negative comments come in. And you also know it's different for if you're someone with cystic fibrosis or you're immunocompromised, you act that way anyway. You're always, and all other jabs that are live or certain kinds clearly say on the inserts that you should avoid babies, the elderly, and immunocompromised people for up to 28 days.
Yes.
But my point is, so everyone knows their own health. I went to a chickenpox party when I was little. I'm not telling everyone else to do this. I'm saying I'm still here. And same thing, you get atrophy, like in your muscles after surgery, your basically immune system can get atrophy. But so I'm going to speed this up. So basically everyone can look for themselves, but basically I use this CBS News link on YouTube. It's very easy to find. Just put CBS News SCOTUS hearing. Basically, through the 5-minute mark to the 8-minute mark, you see Kagan and Keller just basically arguing the grave danger aspect. Okay, so I'm not going to get into that, but this is the one. We talk a lot about people coming into our profession, and this is funny, but I cannot believe that this happened at the Supreme Court. Listen to this.
Unvaccinated people will wear masks and test.
I got to back up.
Works best, which is to strongly incentivize vaccination and to insist that unvaccinated people will wear masks.
Okay, real quick. Under the program management and OSHA, there's a whole bunch of administrative standards people don't really know about unless you work in our professions. You cannot use coercion to push safety. That's a violation within itself. I can't be like, well, if you don't do this, you're going to get this. You can't do it. It's not allowed. But listen to this gem right here.
And test. I mean, that's just like, why isn't that necessary? What else should be done? It's obviously the policy that's geared to preventing most sickness and death, and the agency has done everything but stand on its head to show quite clearly that no other policy will prevent sickness and death to anywhere like the degree this one will.
Justice Kagan, first of all, states could have policy.
Okay, so
we have to unpack this one. It's probably the most, the juiciest that we have of everything here, outside of the fact that these justices really did not focus on the law, as is their job. They focused on emotion, and she has no standing to say that, none. When she says it's obviously the policy that's best designed, what is she basing that on? She's not even an expert in any of this. She doesn't even know what policies are based on. So, okay, let's back up, because we were going to talk about control measures. So I know where you're going with this, Kristen. So keep going.
But what I meant to play, I must have screwed up my minute mark, because this is the gem. And it's quoted right here, and you can look it up. I had it as 8:30 minute mark. Maybe I got it mixed up. Justice Kagan said, this is not a vaccine mandate. She said, this is a masking and testing mandate. Again, coercion. Then she goes on to say, basically, like, masking is nothing new. She said, like in the workplace, people are required to wear masks if sparks are flying in the workplace.
Yeah. Or if you want to start your face on fire.
Okay, well, stop for a second, because this is what I want to address. Yeah. What are the sparks from? What other PPE are they wearing? Is it a well-ventilated area? Are you talking about sparks from grinding metal and cutting tubes for lead splicing? Are you talking about sparks from arc flashes for utility workers? Because there's arc-rated face shields, there's face shields, there's welding helmets. Do you understand? This is not one size fits all. And you guys watching, this is when we say an HRA, that stands for a health risk assessment. I would go in there and I'd say, this is the hazard. This is what you're exposed to. This is a standard that governs it. And here's the control methods. And if we need PPE, we need PPE. We almost always have PPE when there's sparks. You don't wear a mask. And even if she meant like a face shield, the point is that term mask is so conflated. Like N95s are not masks, they're respirators. So she said that. And now, remember when people attacked Trump for talking about bleach, which is not what he was saying. He was talking about actually cycling and cleaning the blood, which is something that was, again, taken out of context, which the left likes to do. Now, what if people start wearing masks when they're doing processes that are creating sparks? Are we going to demonize her and go after her? I want to see a headline now. I mean, if that's what we're going to do to everyone else, you can't say that. As a Supreme Court justice, you cannot say that. You are not credentialed to say that. But the American people will believe her because she's a Supreme Court justice.
Well, she talked about so many things. I'm going to be real honest with you. She was talking out of her ass the entire time she was talking. She was talking as an expert on so many things, but it was very condescending so that you would believe it. So, well, of course, this policy is obviously the most And I'm sitting there thinking, based on what, lady? What do you know about any of this? Nothing. And so we're going to break down why this policy wasn't the obviously only policy, because I want to talk about control measures, which nobody mentioned. So when you are in the world of environmental, occupational health and safety, industrial hygiene, and you are looking to control a hazard, okay, it doesn't matter if it is a physical hazard like a fire, like sparks flying, or if it is a health hazard like an infectious disease. We always must follow the hierarchy of safety and controls. It has been around since the 1950s that those in our career fields who actually look at controlling and mitigating hazards must follow. Nobody mentioned this. OSHA has abandoned this, and it's what they enforce. And this is one of the biggest, most egregious talking points and merits of this whole case. OSHA skipped all of their own hierarchy, and they're going right to implementing a policy that has been proven not to work. It's been proven to be ineffective, and the policy itself is not even on the hierarchy. So this is what's so egregious to us about this. When you are looking to control a hazard, you start with, think of the upside down pyramid, okay? At the very top, it's called substitution or elimination. Well, we start with elimination. Can we eliminate this to completely reduce the hazard or eliminate the hazard out? Can we substitute it? Well, with a virus, no, you can't. Or can you eliminate it? No, you can't. So then you just move down that hierarchy until you find the control measure that works, and you stop there. Okay, so we can't eliminate. Can we substitute? Nope, can't substitute this virus for a different virus. Then we go to engineering controls, and we should have stopped right there, because we do have engineering controls that we know, and OSHA acknowledges as what's called ASHRAE standards. Anybody in the fields of HVAC, heating, cooling, ventilation, anybody in that world in construction, commercial construction will know what I'm talking about. ASHRAE standards are actually engineering standards that OSHA requires employers to follow to increase air cycle exchanges, ventilation controls, to pull hazards, infectious disease, pathogens, bacteria, fumes, whatever it might be, dust, out of the breathing zone and up. And it's a dilution and destruction technology that cycles that. It removes and kills and destroys that entire hazard in the breathing zone for an employee. That's where we should have stopped. That engineering control could have been implemented in workplaces and in homes. But OSHA did not follow their own hierarchy. And so they went right down. Actually, what they're trying to do is say that this, first of all, they tried to say that masks were a control measure. Masks are not.
Well,
PPE,
can I just say real quick?
Yeah.
It is a fact by actions and evidence in actions that this was not about health and safety.
Oh,
because
absolutely.
This industry exists. And
absolutely.
in isolation rooms for TB, H1N1, all these other infectious diseases, things you don't ever want that we know exist in this because we're trained on it. Why do we have isolation rooms in hospitals? We would just have a permanent standard. There's no standard for infectious diseases. Do you understand that? Right. So it's not even a big enough hazard that they need a standard for it because we follow the hierarchy of controls. Right. That's what you're saying. It's so, we talk about this ad nauseum. It's frustrating to me. So I apologize. I'm getting frustrated because it really is that simple, everyone. It's that simple. Instead of setting out the stimulus, we could have hired, I don't think the government creates jobs because it's always government jobs, but they could have created funding for more HVAC personnel, get more engineer. You know how they push people through, correct me if I'm wrong, but at the beginning of this, didn't they kind of like push people that were going through nursing school? Like they gave them a little bit of extra rights that they could do things if they weren't fully graduated, or if you weren't like licensed in a state, they made exemptions. I believe stuff like that happened in healthcare. So why can't you get someone who's not quite graduated as an engineer, but just studies this, or, an HVAC technician who still hadn't taken the test, but is very good at it with someone over their shoulder? We could have installed these on every single building, these devices, or went past the power restrictions, the environmental restrictions that don't allow us to use so much energy. We could have just, ignored that for a moment and let everyone increase to pull more air in. But it's just, there's so much. We could literally do this for 5 hours.
So let's, before we move on, let's talk about the fact that, so they tried to say that masks were a control measure. but they skipped their whole hierarchy. They could have stopped with engineering controls. And masks are not PPE. PPE is always the last level of control down at the very bottom of that inverted pyramid. But masks are not PPE. PPE, there are programs and there are protocols that you have to go through when utilizing PPE. So they skipped everything and went right to masks. Now they're trying to say the vaccine is a control. But we know that control measures, when you implement a control in the workplace, you have to be able to go back and verify the confidence in that control. Well, we don't even need to verify the confidence in this control because we already know for a fact that this control doesn't work. The people that are vaccinated and boosted are still getting and spreading COVID at a very high rate. It's not helping them at all. And now the boosters are less and less efficacious. That's Fauci's favorite word, efficacious. And now they're having to get boosters every few months. So when does this end? Where does this end? The point is, we know that masks and vaccines are not a control measure. They are not the best policy to stop this because nobody is stopping COVID. It's still raging 2 years later, going into 3 years now. So for a Supreme Court justice to say we know this is the best policy out there. It's obviously the best policy. That is so egregious. I have huge issue with her for that. But this is the why behind that. And she has no idea about any of this.
No, because people are censored.
Exactly.
I had my first Facebook removed because I said that these things didn't stop an aerosol. And now you got the CDC admitting it. You got all these public health professionals on mainstream media who aren't even credentialed in industrial hygiene are saying, yeah, they don't quite work. So now we need N95 respirators, which are also not rated to stop it.
Yes, Fauci has admitted these masks don't work. Fauci has also admitted we're inflating the numbers. And let me just read to you, and this is why this was so egregious what they said. I want to read to you what Dr. Fauci recently said. Clearly somebody is giving him some talking points to rein this back because he recently, just within the last week, came out and said masks do not work. And so did, what was the doctor, Leah, I forget her last name, the doctor who was on CNN, who has been
Lindsay Marr. I believe
who's been so doubling down on these masks. I mean, for a year and a half, she has been right in our faces about this. And we just saw her on CNN the other day say, we now know masks do not work. So you have to wear an N95, which is a whole different topic. We're going to get into that.
Yeah,
but Fauci
I have quite a few on that topic because people are misunderstanding
and everything that we have been saying and getting censored for, and people have been getting kicked off of big tech platforms. Oh, now all the quote experts are coming out and saying the exact same thing that we've been telling you. And so Fauci just the other day said, and I quote him, but the other important thing is that if you look at the children who are hospitalized, most of them are hospitalized with COVID as opposed to because of COVID. Big difference. This is what we've been saying.
So he told the truth twice in 2 years?
In 1 week. Something's going on here in 1 week. Oh. Fauci continued. And what we mean by that, if a child goes into the hospital, they automatically get tested for COVID, as do adults. This applies to adults too. And they get counted as a COVID hospitalized individual, when in fact, they may go in for a broken leg or appendicitis or something like that. So it's over counting the number of children who are, quote, hospitalized with COVID as opposed to because of COVID. Anthony Fauci admitted that just a few days ago. We've been screaming this for a long time because we know the CDC actually admitted that the people that have been hospitalized or been counted as COVID deaths, and if they were tested positive for influenza or pneumonia, were also counted as COVID. So they have so conflated these numbers. All right, so many people that have pointed this out have been banned from social media channels for making this exact point over the last year, which is not happening, not just for children, but adults too. So remember, this has been happening since the beginning, and we have been educating you on this and saying this. And now we have Supreme Court justices saying that these numbers are so great that we have the biggest health hazard, the health issue that OSHA has to deal with. And remember, guys, Omicron, one of the things that Kagan said was that Omicron has proven just as deadly and people are dying at these high rates. Omicron is nothing but a cold. It is sinus congestion, a dry cough, little headache. It's a freaking head cold. People are not dying from Omicron. Delta has pretty much swept through and burned out. And now we're dealing with Omicron, and we have Supreme Court justices saying things like this. It is just egregious. So, these numbers are very, very inflated.
I listened and my husband listens to Dr. Mobeen because he's jabbed, like tries to give the truth. He uses this Worldometer website, which tracks, new cases, deaths by day and week. Deaths are down, weekly deaths are down. And I believe in one day, there were 534 deaths. But if you listen to Breyer, I believe I'm saying that correctly, he was saying 750,000 people test positive a day. Yeah, I'll give that to him. That website shows that there's a lot of people who test positive. However, we know that the tests give high false positives.
Exactly.
That's not me saying that. That's why they're supposed to not be using them. But
the
the deaths
CDC
are
actually
down.
recalled them. They're supposed to have been recalled by the CDC.
I have all the numbers here, and I don't want to get too technical, but because my husband wrote these down, he did all this research for me. Let me tell you, it's not about how many cases there are. It's how many people are hospitalized or died.
Exactly.
The deaths and hospitalizations. But I just shared on my Facebook earlier tonight, I spend a lot of time on TikTok, and I follow a lot of healthcare workers. And this woman was doing a calculation of all these claim hospitals in our state of Michigan that said that they are there's so much capacity. And she looked up how many beds they had, how many facilities they had, and she came to find out basically that is a lie, and that there is about just as many unjabbed as jabbed. And I think it's like 6% of the hospital systems are only involving this. But then there's a comment there by a registered nurse from Beaumont Hospital, and it says, I work in the COVID unit, and it's not that we have a lot of, I think she said half of the cases are not people that came in with it. It's that they were there for other reasons and they just happened to test them. So that means that they either were asymptomatic or so mild that they just thought it was a cold. So the problem is that is an accurate number. I will give that to him. There are 750,000 on average is new case, but that doesn't matter. Want to know why? Because we're talking about an OSHA ETS. That does not mean, listen to me, everyone, this is the nail in the coffin of this ETS. That does not mean that 750,000 people got it from their workplace.
Exactly.
And Keller stated within this, I don't need to play the audio because it's not something that people are going to debunk. He said, COVID-19 is not an occupational issue. It's a world issue. And that is true. This is about
he said it's an everywhere. It's an everywhere issue, he said. And that's the problem. OSHA doesn't have jurisdiction over everywhere.
And
only
if
the
people
workplace.
did not read, if people didn't read a lot of the briefs, I did over the past couple weeks. And I believe it was our friend, attorney Aaron Siri, had pointed out this whole, we're worried about worldviews. Well, my goodness, OSHA better tell people to stop eating horrible food because heart disease is a leading killer in our country, which is a fact. So are we going to tell people that they can't go eat fast food or do this or eat that? Does that mean I got to give up my Flamin' Hot Cheetos? I know those are bad for me. But the point is heart disease is the leading killer. And is OSHA going to now go in and say, what do you eat at home? I need your food diary.
Yeah.
I understand the heart disease is not contagious.
Right.
But we're talking about deaths, right?
Right. Well,
so you have to separate. If I go to work, well, I work for myself now, but let's say someone goes to work, 4 days later, they get it. They get COVID-19. I don't know if you got it at work. Why are you going to put that on the employer? You could have got it when you're at the grocery store. You could have got it when you're at, the hardware store. That's the problem with this. You can't outrun a virus, and it's not a primarily occupational setting unless you work in healthcare. And there, like Tammy said, you have the ASHRAE standards, you have the engineering controls. And I don't want to just kind of go on, and I'll pass it back to you, but I have to tell you, I spent a lot of time reading people's questions and comments, especially on Twitter. People ask me all the time about N95s. I have managed the respiratory protection program for over 76,000 people. That is a lot of people. And the reason I've done that for a lot, because every single place I've worked, I've been the IH to manage that program. Even when I was in the military, I was the IH at every base I went to. That's the program they gave me. And I've done it for hospital systems for 12 years. I never, ever, ever would put healthcare workers in an N95 respirator if they were in close contact with an infectious disease patient, especially dealing with an unknown. The only people I put in N95s are if I know the vector, if I know what it is, and I know the size and the route of entry. Because N95s can work for certain infectious diseases. But even then, I'm extra careful, and only the people that are nutritional food services that'll bring the cart to the isolation room, the registration services that go outside the isolation room, and the admin sitting at the desk. If you are in direct contact, you're taking blood, you're doing aerosolized procedures, you are in a powered air purifying respirator or a controlled air purifying respirator. Ladies and gentlemen, and they, thems, let me tell you, an N95 respirator is not rated to stop an aerosol, and it is widely known by scientists and doctors and aerosol scientists that the primary spread of COVID-19 is aerosols. So therefore, you have to find proper protection and fit factors through respiratory protection for healthcare workers, and it is not an N95 respirator.
Well, and we have to keep pointing out all of the details about these erroneous statements and give you all the facts so that you have educated talking points. Before we really move on, we need to continue on with these control measures. Okay, well, I know the N95 conversation is very important too, because now they're saying, oh, now they're backtracking and they're completely pivoting and saying that masks don't work and everybody needs to now wear an N95, which is totally illegal in the workplace unless you follow the respiratory protection program. And how many of them are? They're not. They're just handing out these N95s. So call OSHA. Call OSHA on your employer and turn them in. But one of the things that we need to talk about, and that is really one of the biggest talking points with the overreach of OSHA, which is what this whole thing is supposed to be about, the overreach, OSHA violating their scope of authority and what they're allowed to do. Well, control measures never, ever follow you home. OSHA only regulates the workplace. So if we come in and we put in a control measure to protect you, like say those sparks flying, hot slag, sparks, whatever. So we're going to evaluate. It's what?
Get your mask.
Yeah, get your mask, right. We're going to evaluate what type of mask you need, Justice Kagan, what type of PPE you need, and will it protect, and all of that. When you leave, you do not take that home with you. You do not have to go wear it at home. No control measure that OSHA oversees follows people home to their work, to their home, from the workplace to their home, ever, 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 ever. So to now go out of their way and get involved in and stick their nose in as a federal overlord into the details of our lives, where does it end? What you now have to inject into your body, first of all, with a bloodborne pathogen standard, because that's what they tried to argue. OSHA's counsel tried to argue that they actually have done this before with the bloodborne pathogen standard. No, they have not. She is taking that totally out of context and trying to make it into something that it's not. What OSHA has said before was that in medical facilities and workplaces where there is a high level of exposure to blood and other potentially infectious materials, that workplace has to do a hazard analysis, and they have to provide at no cost to the employee the Hep B shots, the flu vaccines, things like that. But they've never mandated that the employee must take it. And if the employee doesn't take it, it's always the employee's choice. If the employee chooses to opt out of that because they don't feel comfortable with injecting that into their body, they don't have to. There are exemptions, there are allowances. And OSHA would never, ever go punish that employer if the employee opted out. It's always up to the employee. So this whole thing, what they're trying to make it, is so beyond OSHA's reach, and they've never historically had this kind of power. The OSHA Act, Congress, historical precedent, and the federal powers all are very clear on this. And this is what was the most bothersome thing to me about listening to these justices, because they are not focusing on the actual point. The point is OSHA is overreaching, and the merits were not provided to them factually. And that's why we felt like we had to come in here and do this. So let's keep going along with this. I want to give you some more talking points because—
Well, can I play this clip real quick? Because this is going in flow of what we're talking about. So you brought up a lot of items that were discussed, so I'm not going to play those. People can all check it out. If you want to follow mine with the CBS News, we're right around the 22-minute mark now. So this is where I think you say Sotomayor, yeah. I can never say it correctly. I don't want to disrespect her name. Listen to this really quick. Whoops. You know what really helps is if I put on the volume. If you guys see me looking down, it's not that I'm ignoring Tammy. I'm trying to find the next clip. Okay.
COVID keeps people out of the workplace for extraordinary periods of time. And there have been proof in certain industries like the medical industry that when vaccines are mandated, and there's no mandate here for a vaccine, there is a masking mandate, no different than there is when we tell people that if there are sparks flying.
Yeah. So that's the sparks part, but that's the part I want to explain. I have in my notes here is that she is basically saying that prior to that clip, you hear Attorney Keller say, this is what upset me with him. If I doubt he's watching, but when he was asked why he was asking for a stay, he said, because if this goes through, a lot of people will quit and it will ruin the workforce.
I know.
Representing we the people. So first of all, she, it was Kagan. No, excuse me, Sotomayor. Mayor, yes. I even have a little H there, so don't screw it up. But hey, thanks for the correction. She was talking about, a lot of people will miss work if they get COVID. Then why did the CDC just change it to where you can go back to work 5 days after you test positive? Because you understand what a work shortage does. So if this is such grave danger, how can you go back in 5 days? Because people I know that have had COVID were not better in 5 days. I'm not saying they were on a vent, but they were like, oh, I'm just sluggish and tired. Longer than 5 days. So what's funny is that this ETS was pushed and has been questioned, I believe, since November. But since November, the government has changed their narrative. Again, now they're admitting masks don't stop this virus. You need a respirator. Oh, so we're going now from source control to PPE? Well, you better have a respiratory protection written program. But the thing is that she just goes on and on and on about all these things that are now no longer relevant. The argument with this ETS, because the ETS for healthcare workers expired and they didn't do anything about it. And those are the people who have the greatest hazard. And that's another thing we need to point out, because I understand. I apologize, everyone. We're all over the place, but this is a candid conversation because this is how we talk on the phone. And you need to understand that we don't do one size fits all PPE ever. Like when she said, when Kagan said, oh, when sparks fly, that's that again. What are you doing? Where are you at? What else are you wearing? There's so many things where PPE can cause a greater hazard. So we have to do different things. When you're talking about this, I look at healthcare workers. I don't even look at them the same. I was embedded in a hospital system for 12 years. I didn't see patients directly unless I went into their rooms to do environment of care rounds or other issues like fixing things in their room, indoor air quality, all those things. I didn't have purposeful direct patient care, but because I had like unknown, I can be exposed to anything. But I don't treat someone that's working in an infectious disease unit as the same person that's in a kitchen prepping food. So even within a healthcare system, you have different exposures. You have different exposure groups of people. So we're going to say that the person that's begging your groceries, if they're not vaccinated, if they're not jabbed, then they have to wear a mask or have testing, which we already know from, I believe it's Carrie Mullins that invented it, who mysteriously died, said this is not to represent what it's being utilized for. And this is the bigger problem. Every single thing they're doing is wrong. Every single thing is wrong. This is not our opinion. We're literally coming to you from the OSHA training we've had. We have almost a combined 40 years experience in this field. And we agree on 99.9% of everything. That should tell you something. And we're not alone, folks. We're not alone in this. I know a lot of people in OSHA are watching right now because they message me and say, don't stop speaking. And a lot of them are prior military that I worked with. So they know, people know. And that's why you need to understand that it is scary that these are the arguments that were presented. But, with that said, there's still a lot of attorneys that'll think this will be stayed because it, like Tammy said, it comes down to the authority aspect. That's what was being argued here. Not all the fear. Do they have the authority? No, they don't.
Well, and this really is obviously to us as preventive health specialists in the world of environmental health and safety. This to us is not about health and safety, because if it was, the government would not have abandoned a traditional multidisciplinary approach to pandemic response. Why did they do that? We were asking ourselves that a year and a half ago. It's the reason I stood up and became an accidental activist, because I watched our government actually abandon all traditional and accepted protocols for pandemic response that I've been trained on, that I know this is my world. What are we doing? And we listened to one person, Dr. Fauci, who has flip-flopped so many times. Now he's actually saying the things that we were saying a year and a half ago, and he's agreeing with us. So I think this comes down to control and what is going to come next. And when you
want to hear what's next?
Yeah. Well, I do. Hold that. When you look at the fact that Washington, if you listen to Heidi St. John's, who's running for office in the state of Washington, just came out and she talked about how on January 12th, what the state of Washington is going to be voting on and implementing quarantine control camps, internment camps for individuals and groups of people. Who would that be? Families that have not voluntarily complied with the testing, the vax, and all of that. They're going to vote on the government physically removing those people and putting them in internment camps. It's coming. She put out a big thing on that today. Then I just read about this program called Vax DC, and it's starting, I believe, on January 15 in the District of Columbia. According to the mayor, you will not be able to enter that city into any indoor establishment unless you show your papers that you've been vaccinated. This is what's coming next. It's absolute control. And that's what OSHA does not have. That's the whole point of this. And that's what these Supreme Court justices totally missed. I think there's maybe one or two who got it. And they didn't say a whole lot, which kind of concerned me. Like, come on, guys, speak up.
You know what? I think that the silence by many of them is actually a good thing, because I don't think they wanted to kind of show the hand of why. But you could hear, especially Justice Thomas.
Yeah, Thomas, right.
He was basically like handing on a silver platter talking points to Keller, and he just didn't pick it up.
Yes, I got that.
Kind of like, wink. Is this what you mean? Because
he was leading
him. I know Thomas knows.
Yes.
But this is a gem. This right here is Justice Kagan. Ready? Oh, dang it. Sorry.
A virus, bloodborne viruses. Are you questioning Congress?
Okay.
That is the...
Why is the human being not like a machine if it's spewing a virus, bloodborne viruses? Are you...
So this is right after the sparks fly comment, and Keller responded actually greatly when he said, well, that's specific to a workplace, because those people would have certain controls based on a piece of equipment or a process. Because remember, controls are process and task specific, okay? Yep. And exposure groups. And she was saying, why are people not viewed as a machine if she was calling this a bloodborne virus? And now I've misspoke too, so I'm going to kind of give her that a little bit. But we are not machines. We are people. Right. And if we're worried about the spread, let's not forget you spread aerosols by breathing, not singing or yelling or coughing. Yes, but you can just spread aerosols talking and passing gas and using the restroom. So why are there no talks of toilet seat covers? I mean, we are not addressing the vector and the routes of entry of exposure. And when I say routes of entry, you have to understand the source. So I'm not trying to be gross, but if someone passes gas and they have COVID, it can spread the aerosols.
Yeah, that's right.
I'm serious. That is literally, that is science. That's truth. So why? We are selectively addressing the hazard here. And that's why I'm so irate. And it's like, I know you feel me, but my brain just goes in a million different places because I can't wrap my head around how we're the most out there people, but we're not the only ones speaking. Mm-hmm. And after hearing this, I really hope other people are like tweeting or coming out and saying, this is incorrect. Yeah. But I think it will, because I think a lot of people were scared of losing their jobs and just thought, well, when this gets to SCOTUS, it'll be over. So, but either way, if something happens, these people, I don't think this can be enforced, is my point, no matter what. You're not going to get people to go out and cite you for this.
And, that's part of an ATS getting approved. And one of the biggest points is that I think Brett Kavanaugh and Neil Gorsuch made was that whose authority is this? They kept saying, by whose authority? And Neil Gorsuch actually pushed a statement along with the 11th Circuit Court when they ruled to stay this mandate, that Congress has not ruled. Congress has clearly not given them the authority. Just because this is an emergency temporary standard does not mean they don't need congressional approval, because they do. And Congress has not even taken this up because they know it would be a political career suicide if they did. And so Neil Gorsuch actually stated, along with the 11th Circuit Court, very accurately, that it seems that the executive branch is using this regulatory agency as a workaround around Congress. And that's exactly right. He said one of the truest things, and he upheld what the 11th Circuit Court panel also stated, which I think is very important because Justice Thomas and Justice Gorsuch know this. Now, I'm not real confident in John Roberts. He's not voting for the Constitution anymore. I'm not confident with Amy Coney Barrett, even though she had some good questions. She's the one also who did not rule in favor of the students with their religious vaccine exemptions. And I was incredibly disappointed in her. So I don't know that I have a lot of confidence in a lot of these judges. I mean, who knows? But we wanted you to understand where we're coming from looking at all of this. And one of the things you also need to understand and recognize is that one of the basic tenets of public health policy, okay, public health policy, when you are going to create a public health policy, which, by the way, OSHA does not do, that's HHS. If you're going to create public health policy, you have to look at, and this is taught in classes. Dr. Kristen's husband, Nate, who is a public health professional, he can tell you this. In master's level classes, it is taught that the number one rule in public health policy is that we have to look at what works, what is a policy that is effective, but also does not ever violate the individual rights and liberties, the civil rights and liberties of the citizens. Now, stop and think about that compared to what we're doing right now. They've thrown it all out the window, just like OSHA has thrown, one of the big things too is that OSHA is violating their own PPE and respiratory protection standards with all of this. Nobody's talking about that. And public health policy is being violated, basic public health policy 101. And these are things that you need to understand. And they're talking about risk. Well, I'm sorry, but you cannot eliminate risk from our lives. They're trying to make it so that we have no more risk. It's all about our health and safety and keeping us safe. Kagan talked about, in response to the workplace violence argument brought up by Keller, he said, there's workplace violence, but we don't create standards on that because there's always a risk. If I go to work, there may be some workplace violence. And she actually said, I think we should. She actually argued.
There's an emphasis program for workplace violence.
Yes.
And, I remember this because I was working at the VA and I was working at the Jesse Brown VA, and right next door was the VBA, the benefits. And that's where the veterans went that were pissed because they weren't getting their compensation. And that's right around the time, because we had active shooter drills, because I'm not sitting like all these veterans are crazy, but let me tell you, you mess with the veterans' benefits and their medical care and you turn their back on them. Yeah, some with their PTSD, some will lose it. And we had people coming with guns. We had people threaten to kill us. And we shared a parking garage, and we had massive training on workplace violence. And it was never a standard. It was an emphasis, meaning under that Rule 5, under the general duty clause, I always tell people where there's a hazard, where there's a standard, there's a hazard. But where there's a hazard, there's not always a standard, because there would be 1,000 standards more. I mean, I would say like hundreds of thousands of standards. I mean, there are a lot of standards. I got to correct what I just said there. But my point is, we don't have a standard. We don't have a standard for infectious diseases.
And that's really where it should start. If we want to have a standard to cover all infectious diseases, I'm actually in favor of that, because we should have sanitary workplaces. There should be cleaning protocols. There should be training protocols for employees that if you're sick, if you have a fever, don't come to work. Wait for 24 hours after your fever breaks before you go back to work so that you're not contagious. I mean, these are just basic, very basic health etiquette strategies that employees should be taught, right? And so that I would not be opposed to an infectious disease standard, but to just say COVID-19, which is very telling that they are using this particular virus and this particular pandemic to implement controls, to take government control, and to create the government as a federal overlord that will get to dictate every area of our lives. That is clearly what's going on here. And so we wanted to just break down these individual arguments for you so you understood from a technical, regulatory, legal perspective, some of the things that were said were so wrong, and why, and what's the truth behind that.
For the sake of time, because this is very important, so this can be long-winded, everyone. You're going to actually want to hear this. You're not going to hear this in the mainstream media.
Right.
So I'm not going to play the audio anymore, but I will give you timestamps so you can fact check me on the CBS News version of the video. So at the 27:57 mark, I believe it was Kagan that said that OSHA, she said that OSHA experts were basically the ones who wrote this ETS. Experts? Experts, there's an expert council. When OSHA puts in standards normally, the experts are actually not allowed to be in OSHA. It's like when cops have an issue and they have internal affairs, there's always a joke about whether it's a business or a government agency. Oh, we investigated ourselves and found we did nothing wrong. So OSHA goes to, like, people say we don't work for OSHA. Well, you're damn right. I don't want to work for OSHA. I actually am above that. I was my last government position, I was a GS-12. If I went back, I'd be a 15 now. So my point is, they would reach out to our community, and they do that. Especially if you're an OSHA train the trainer, you're on the OSHA list like we were. Well, before they decided to come after us. But, I've resigned with a lot of the agency I was a part of because I won't align myself with people that are pushing this agenda. But my point is, folks, they did not confer with the experts. They only conferred with themselves, and they took what Biden had told them to do and strong-armed them to do. I'm telling you right now, OSHA darn well knows they cannot do this, that they are not telling the truth. These are facts. You have to understand, we are telling you facts. This is not an opinion. The best way to control an aerosolized hazard is through engineering controls. It is not through a jab that is known to still cause transmission. Now, the claim is that it reduces your likelihood to be hospitalized. I'm not even here to argue that because I have my opinion on it, but that's not my subject matter area of expertise. My area of expertise is understanding better control methods. Jabs are not control methods, like you said, Tammy, because we can't verify the confidence in it. But we can with engineering controls. Plus, we have decades and decades of this type of engineering controls being utilized in isolation rooms and giant facilities. For example, a lot of people don't know this. Remember in the McCormick Center, if people remember, the governor of Illinois set it up to where they thought there'd be all these massive people coming in with the illness. And did you know when they do that, they have to send in an industrial hygienist with HVAC and engineers to go in there when they're preparing for that to adjust the air, the increased air exchanges before they even can put the beds in there? That's not the kind of stuff that's explained on the news. But that's what's done. That is a requirement. So it's not new that we want engineering controls, is my point. But I tweeted about how all I heard was lies, and some people came at me like, oh, they lied. Yes, they lied. And if I'm in court, I have to be able to cite all my sources with exhibits. So I don't like how these justices can just say anything and not have to cite it, because that is, to me, that is highly criminal.
Well, and I want to expound on a couple of things, and then we probably should wrap this up because it's been over an hour. But there's just been, that's why we told you to grab a note. That's why we told you to grab a notepad, because you're going to want to take notes on this and go back and watch it and take notes and note down the minute marks that Kristen said, and then watch. Was it a CBS Live that you were watching? Where did you? Where
on YouTube, I watched the CBS Supreme Court hearing. So you can look up everything I just showed you.
On YouTube. Okay, so one of the things that I want to expound on that Kagan stated, Kristen, you were just talking about this, is that this was written by experts, by OSHA experts. Again, no, it was not. But what she said was OSHA's decision is based on expert opinion. And then she said they are the experts in public health. And I about lost it when I heard that, because number one, like Kristen just explained, no, this was not written by OSHA, nor is it supposed to be. Number two, she said this has, they have created, OSHA has created a public policy that is widely supported by who? Not by the health and safety professionals.
Exactly.
Not by engineers, not by industrial hygienists, not by OHS professionals. Who is supporting it? Liberal, progressive liberal politicians. That's who is supporting this, because this is an agenda of control. It is not supported by science, data, or evidence.
And
that
I can
is a
tell
legal
you,
term, and it does not meet the legal requirements, because those are legal definitions. There is no science, there is no data, and there's no legal evidence to back up what she's saying they have wide support for. So that's crazy.
Not to change gears real quick, but everyone's kind of familiar with the defamation with malice article from the Daily Beast. I am a member of the American Industrial Hygiene Association, and in I saw a quote, and I reached out to our mentor and colleague, Stephen Petty, and I was like, what? Why would anyone say this? And it was a quote from a certified industrial hygienist claimed that, or maybe it was Larry Sloan, who's in charge of the AIHA, who's not an IH. But anyway, it falsely said that of all the members, a large majority, or like over 900 of them, agreed with these protocols. And I asked Stephen, I was like, did you get asked? And he said, no, because they have before. When there is emphasis programs or proposed rules or anything like that. Also, we have something in our profession called consensus standards. Yeah. Like the NFPA. That's a consensus standard that OSHA will cite for electrical things because they don't have a lot of electrical standards. That was actually a question, and I couldn't believe that nobody said that during that. But my point is that nobody polled us, and that was one of the lies. We were never asked, and they never claimed to have asked. And we actually asked for the legal fight for proof. Nobody was polled. So everyone just makes this stuff up. Oh, yeah, they surveyed all the industrial hygienists in the American Industrial Hygienists Association. No, you didn't. You never asked us. So it's a huge lie to say that all these people support it. I am telling you right now, I have not met one industrial hygienist, senior industrial hygienist, or a certified industrial hygienist that does not work for the federal government or take government money that is for any of these control methods that are being proposed in this ETS. I have yet to meet one. I have not met one. Not even the left-wing ones.
Yeah. But we meet
because they work for the government.
Yeah, but we are contacted by those all the time in our professions behind the scenes that say, keep going, keep saying it. I can't, which, we get very frustrated with because we've put it all on the line. If everybody is not willing to sacrifice and stand up, I mean, the power is in our hands, we the people, to shut this down. So we're all going to have to sacrifice and pay the price for freedom if we value our freedoms and we don't want this complete, tyrannical dictator communist spirit to take control. We are going to have to stand up and fight. And it may cost some of us our jobs. That's not the end of the world, guys. It's a major employees market right now. There is a severe labor shortage, which is, I think, one of the things I want to end on. Because Justice Breyer was arguing today against the economic fallout to businesses, which is going to be huge. It's going to cost businesses billions of dollars. And that's one of the most overburdensome, overreaching aspects to this, that OSHA cannot put overburdensome regulations on employers. They're not allowed to legally. And this is why this suit was actually brought by the NFIB, the National Federation of Independent Businesses, because they are saying it's going to put us out of business. We are going to lose so many employees. And he said, well, some employees might quit because they have to work alongside of an unvaccinated employee and they're afraid that they might get this virus. They might catch this disease. And I thought, are you completely out of touch? In November alone, I was just looking at this statistic today. In November alone, we had a record 2.4 million people quit their jobs. 2.4 million of us stood up and said, not me. And they quit their jobs. And I am so proud to hear that, because that's exactly what it's going to take to shut this down. And the NFIB knows this is why they brought the suit against the Department of Labor. They know that this is going to cost their businesses. But what we, the people, have to remember is that's how we take it back. The power really is in our hands. Nobody can make you do anything. I don't care if OSHA puts this in place, if the government puts this in place. It is totally up to us what happens to us. Nobody can make you do anything. So while we can stand up and we can say no, and we can choose to walk away and go get another job, again, it's not the end of the world. If that's what it comes to stand for your principles and to shut this down, because it is such an employee's market out there. And so as more and more people quit their jobs and walk away in defiance, there's going to be more and more jobs, and more companies are willing to respect your rights to your personal bodily autonomy and your personal health making decisions for you and your family. So don't be afraid. Do not be afraid to stand up and to say no. I will not comply. And I know it seems scary, but what's on the other side of that is even better. So just trust God. He will bring you something even better on the other side of it, because he does reward faithfulness, right? So that's what I wanted to end on. Oh, I'm sorry. That number is actually 4.5 million, not 2.4. The number of people that quit their jobs in November, 4.5 million. That's awesome. To me, that's awesome because that means we're the drivers.
Free market solutions. But what's concerning
right.
is that if this is just grave danger and all these
Right.
people are in the hospital where they can't even get care anyway,
Yep.
they're denied proper treatment. Are we not concerned about the amount of healthcare workers that are bailing?
Yes.
Because the goal of a hospital, working in healthcare for well over a decade, the goal of a hospital is actually for bed turnover rates. That is the goal. And the charge nurses know this. And if you're a nurse, you know I'm right. It's the bed turnover rate. So they want you in and they want you out. So if you're gone and you're deceased, I'm not saying all healthcare workers are dirty like this, but don't think that this isn't a whole. We know about the scam of in healthcare with organs and all this stuff we can debate. Not everyone is bad, but there are bad apples in there. But I also just want to reiterate that our peer-reviewed white paper article, whatever you want to name it, it's kind of a one of a kind, where we just spelled out all the information of why this was illegal, is attached to this hearing in one of the briefs, several of the briefs. But I wanted to point something out because Tammy and I have been talking about this a lot because I will get asked all the time, do you have this thing that's peer-reviewed? Do you have that thing that's peer-reviewed? Let me tell everyone the peer review process.
Let's talk about peer review and what a joke it's become.
I have 3 books in my office that talk about the scam of peer reviews. Watch the documentary Bought. Now, we did a peer review just to make sure, not for you, not so you viewed us as more professional. It was for us. It was just, it was more of like we had Stephen Petty review it. A whole bunch of people go, are we interpreting this correctly? Do you agree with us? Because we're going to put this out. So, but a peer review process, I literally can have one or usually it's 2 people in my profession look at what I'm saying and basically rubber stamp it. Peer review process. Do you understand? There's no like actual protocol for a peer review. One of the CIHs on Twitter, he's so funny. His name's John Maverick. That's his name on Twitter. He's a CIH and he's a PE and a CSP. So if anyone wants to know what that means, he's a certified industrial hygienist, professional engineer, and a certified safety professional. We met on Twitter one time because I went on this whole tirade about how these devices do not stop COVID at all and actually increase the spread. And he put all these things and he goes, oh my gosh, thank you for echoing this. I've been saying this. He's like, now you're peer reviewed. Like in my profession, especially, I know when I worked for the government, mostly I had companies reach out to me that were trying to give me equipment or PPE. And they actually would give me something they wrote. And they're like, can you review this? And if correct, we're going to put your name on it. And it had a whole list of people that have already seen it that I didn't even know. And they were trying to say this is a peer-reviewed publication. Are you kidding me? If I didn't write it, I'm not putting my name on it as an author. Peer-reviewed is such a flawed process that if you actually ask people who don't work for the government and do not benefit off of what they're talking about, we're not making money off of telling this story. The peer review process is flawed because it is so biased and it is so fraudulent. Like you just have to watch the documentary Bought. Watch Bought. It's on YouTube. Watch it.
Yep.
Do you have anything else to add? Sorry.
All of this craziness that's been coming out when people throw in our faces, well, what about this? What about this article? You know, this is peer reviewed. And we laugh because we're like, there's nothing scientific in there. It's nothing but conjecture. And doctors and scientists today are being paid to write opposition research and then they peer review each other's stuff and get paid. It's so corrupt. It's ridiculous. But when we go through the peer review process, again, we are very ethical. We bring it to the top public health professionals, scientists, engineers, professors, you're talking about the most qualified eyes and ears out there in our career fields reviewing it. Nobody's getting paid. We're all just reviewing each other's stuff. But it's a joke because people say, oh yeah, they're peer-reviewed paper. And then they try to make it like it's something ridiculous when we're the only ones that are being ethical in our peer review.
Right.
So
and I just want to address, because I saw in the comments, people are asking, what is it called again? It's a documentary called Bought. Like I bought it at a store, BOUGHT. So it's Bought. If it's not on YouTube, I'm pretty sure it's on Rumble or Brighteon, which is BRIGHTEON, Brighteon.com. It would be on there. But that is that was the first time I actually learned about it. And that's what made me buy a lot of books that were written about it. And it was a lot of doctors and scientists and epidemiologists, a lot of laboratory personnel exposing how many people had approached them. And that's scary to expose it because you can lose grants. It's a huge rabbit hole, to tell the truth, in that world.
Yes.
They explained how these benefactors, like the companies that they were writing about, or the products or processes, they wrote the stuff and had their name on it. Like, there's so much corruption in the scientific and healthcare community. This is why I can never work in a hospital again, unless it's something that the frontline doctors put together, and I know I can do my job.
In the medical community, in the pharmaceutical community, it's nothing but corruption today. Nothing but corruption. So, we felt that this was very important to explain to all of you and to expose. And if you want more information on the details, the science, the medical aspects, the legal aspects of everything we've covered today, you can go to standupmichigan.com. It's all one word, standupmichigan.com. And you can actually download right on the homepage. There's kind of a rotating carousel, and there's the OSHA paper right there that you can download. It's just $1. We're not looking to get rich off this by any means, but we have donated thousands and thousands of hours over this past year. My husband and I actually figured out how much we've donated, and it's kind of scary.
I was going to say, do we want to say that? Because I'm not even
going to tell you the number from, walking away from a business and choosing to cut ties with these regulatory agencies that I've worked with, and just go fight for our freedoms and to get the truth out there. But, the point is, we do a lot of this. Everything we've done is on our own dime. And so we've made this available because our goal is just to get the information out there. So for $1 a download, it does help to support our efforts a little bit, support our websites and our IT and all that. But you can get all that information if you just enter your information, then it'll download. You can download that from there. Once you enter your credit card, if you enter for $1, whatever, then you can download that paper and you can take that. That's a resource you can take to educate people, your HR departments, with your employer, your schools, things like that, even your medical systems. I mean, they're some of the worst. They should be the best about this, but they're the worst because they've bought right into all of this corruption and all of this false narrative. So anyway, if that's, people have asked, what can we do to help? Where can we get the resources? That's helpful. If you donate to Stand Up Michigan, it helps to fund the work that we're doing. And then you can get the resources that you need to educate yourself as well.
And I also want to add, I mentioned earlier that, being out in the open, a lot of people that don't come forward are so afraid of being dragged through the mud. I've been dealing with this for well over a decade. I've
still getting dragged through the mud.
But the problem is people can mock me. Yeah. People can mock me. They can talk about my appearance. What you can't do is lie about me. You can't lie about my credentials. You can't lie about what I'm doing. You can't call me a grifter. You can't tell me I'm making money off this when I'm losing 6 figures. I'm losing a lot of money, not just from donated hours, but prior to realizing the hole I was putting myself in, I was donating a lot of money to other causes financially. So that's not to sit here and cry, woe is me, but I am suing the Daily Beast for defamation with malice. And I have another, I'm not going to give it the attention, but let me just tell you, I have people who've read that article and are using it to cyber stalk me and engage in targeted harassment. I had an issue where I was followed the other day. I can't say who that was, so I'm not attaching it to any entity or person. Actually had to call a grocery store for the footage because I had an old lady tell me I was being followed. So it is very important I clear my name if you want me to continue to stand up for you. My retainer is $16,000. I raised just over $9,000 of that. The Give, Send, Go link is temporarily off until probably Monday now. It's not because of fraud or anything, but Give, Send, Go uses a payment system called Stripe, which is actually designed for businesses. So I accidentally put in a wrong thing. I was supposed to be an individual instead of a business. So it got halted until I could verify some information. So I can't give you the link to the Give, Send, Go. It will be back up. But if you go to my Twitter, which is at Kristen Meghan, you will see a pinned tweet where you could donate $5, skip a coffee. I'm not a grifter. I don't beg for money. I'm actually the other person usually raising money for other people and donating resources to those that need it.
Right.
So, you know, a little bit of
Kristen,
$1, $2, $3, it helps me. It helps me so much. Not personally. It's going straight to my attorney. And I'll be sharing the details of who that attorney is once I have paid this retainer.
Tell
and
me.
It's just important.
Tell me again. I'm typing into the comments your PO box now. So if people are
Oh,
more
I don't have the
comfortable
PO box just yet. We had the ginormous snowstorm. I was going to set it up this week. I couldn't leave my house with my broken foot in the snow.
Okay.
But if you go to Twitter, basically anywhere there's social media, I have an account as at Kristen Meghan. And if you go to any of those places, you'll see I've been posting. You can use Venmo, Cash App, PayPal, all of that. Just know if you do decide to donate, I'm only asking for a couple dollars. Some people have donated a lot more, but that is not expected. And in the comments, please put DB for Daily Beast so I understand what you're donating for, and I can put those in my records properly. And if something comes of this, I will definitely be paying it forward to other court cases. This is about clearing my name. That is the ultimate goal, folks, because I have a really strong heart, a lot of personal integrity, and all I want to do is help people who can't get help without paying someone. Like, we could be making $3 to $5 grand a day in these court cases, and we are not charging for them.
Right. Exactly. Well, I can't, Facebook will not let me type in. I just typed in your name, your handle on Twitter, and it won't let me post it.
It's okay. They can find it. And I can post in the comments of this live too, but I just wanted to put that in there because it's always hard to ask for donations. People will make fun of you, but the problem is that in a free market society, we all help each other. Well, I'm not trying to buy a Nintendo or
here's
or
the thing. I don't even like to have to say, oh, I don't want to ask for money, because what we have given and given and given and given has cost us so much. For everybody out there, that if we need $2 or $5 to help support this work, what is that? You know, when people ask me all the time, how can we help? Well, here's how you can help. It doesn't cost you much more than a cup of coffee. So anyway, well, we hope that this has been beneficial for you. We knew this was going to be long because there's so much in this that we have spent a day and a half dissecting and studying and writing down notes. And so go get that white paper if you want all the information at standupmichigan.com in front of you. And these are the talking points that we've gone through. We've used all that information in the white paper to give you information on why what the justices said was so wrong, and why they weren't provided these actual merits and talking points is beyond me. But they should have had, these attorneys should have had subject matter experts who are industrial hygienists and OHS, EHS professionals to argue, and they didn't. So, you know, now all we can do is pray, guys. Just pray that they rule in the correct manner.
I really, I'm leaning towards, I'm pretty sure they will. And the reason is because if you listen to the arguments, I'm not going to lie, I was sweating bullets. I was like, what is this person doing? I could have done a better job.
Exactly.
And I do want a Monday mortar quarterback, because what the hell? But I can tell you that I looked on Twitter, and a lot of employment attorneys were watching this that specialize in workplace legalities. They were even like, yeah, this will be stayed. I can see it. And they thought, who would be for it, who would be against it. Again, until it's stated, anything can happen. But if the worst happens and this is upheld, you as a business owner, if you are a business owner that thinks this is wrong to do, please understand you still have a right when it comes to an ETS to a judicial review. That has nothing to do with this hearing. And it's basically allows you to show, I've implemented these other risk reduction methods, therefore I don't feel I need to follow this. And that's when you implement the engineering controls we've talked about. And heaven forbid this thing gets upheld, we will come back on and we will do a very concise, informative video to the point with resources and explain to you how you can prove that you've done other risk mitigating efforts. So the road does not end with just this decision. We're going to continue to fight for you, because we all know, just like in our state, when our governor was shut down with her powers, she shifted it to the health department. So who knows what other agency Biden will try to put this on, but I really think he knew that this would get stayed. It wouldn't be implemented. But what did he do? He scared you guys into submission. So thank you for joining us. Again, I'm sorry it's kind of all over the place. This is our happy hour. We just needed to kind of come on, and we couldn't just post this in a typed up post. So
And I'm seeing some questions too about when do you expect a ruling? Well, this is supposed to be implemented Monday. So I would expect they're just taking a couple of days to talk about this. And I do believe that we're going to hear something maybe even tomorrow. But I would expect something to come before Monday. So we'll see.
I agree. I actually thought something would happen today.
Me too.
They have thousands of documents to review, and I hope they found ours, because it's very important to see people who've been implementing these types of things in the workplace. And a lot of these justices have no idea about these engineering controls, and we outline it. So thanks for jumping on. Stay positive, you guys. Remember, we always tell ourselves it can't get worse. Well, this, to me, this is pretty much the worst. I have faith it's going to go our way, but again, you don't know until there's an answer. But don't freak out, because remember, if you work for an employer who's not going to stand up for you, you need to get a new job. But if you are a business owner who's free market minded, liberty minded, and you respect your employees and you want to properly keep them safe, you'll follow through with alternative control measures. And again, we will come with you with that information, whether or not I think we should still tell people how they can properly control their workplaces by providing links. And we can pull up some graphics and show you videos of places that they put them in prisons and schools. So
that's right. Yeah. So no fear, no fear. Stay positive. Stay in prayer. God's got this. God's got you. God's got us. And there's strength and there's power in numbers. No matter what, we don't put our faith in the Supreme Court. So if worst case scenario happens, we'll be coming at you with some alternative options. And even in this ETS, it does give you options. So no worries.
I have one last thing. One last thing. Yes. Please take this how it's intended, which is not being rude. If something happens, can you please not blow up our phones?
Oh,
because you have to understand that it's not just our followers and our supporters and people that have questions that are contacting us. It's attorneys generals. It is lawyers around this country.
Legislators.
It is business owners. I had to put my phone on Do Not Disturb yesterday. I'm not trying to be rude, but if I'm freaking out, you better believe I need a moment. So give us time, and we will come help you.
Oh, yes. And, just understand that, yes, we are seeing this. So, yeah.
And if there's breaking news, trust me, we're the first to know. So you don't have to text us the answer. We'll know.
Yes, we're on it. So, all right, guys. Well, thank you so much, everyone. Have a great Saturday night. We wanted to wrap this in time to give you a chance still to go out and enjoy your Saturday night, or snuggle up on the couch and watch a movie, whatever you've got planned.
But I'm going to finish watching some Yellowstone. So
yeah, I told you you'd love it.
No, well, I don't know who watches it, but let me just tell you, Beth is my spirit animal.
You know what? This is the thing.
On that note, I'll take a drink.
And this is who we are. Beth, we were, if we did not have Jesus, we would be Beth. Let's just say that. So, all right. Love you guys. Have a great night. We'll talk to you later.
Good night, everyone.